Hello, I'm Dr. O'Malley, Medical Director for Non-Acute Care Services at Partners Healthcare. I'd like to welcome you to IMPACT, Improving Massachusetts Post-Acute Care Transfers. I'd like to talk to you about our Universal Transfer Form, the UTF. First thing to know is it's not a form at all. It's actually a data set of all of the elements essential for any receiver of patients in a transfer, from any transfer between post-acute care and acute care facilities. We took many other transfer forms that have been developed by multiple organizations, Michigan's Ticket to Ride, the Universal Transfer Form that was implemented by the Joint Commission, Project Boost, and any other source we could find, and merged them into one standard format, which included all of the data elements contained in any of these organizations' transfer forms. On the basis of this, we then created our own universal transfer form and tested it in paper form in phase 2 and had it used widely across the state for about a year and a half. And on the basis of that feedback, we realized that a paper form was no longer going to suffice, that this has to be an electronic format that could apply specifically to particular transfers of care. There were some transfers that required many more data elements than others, and some transfers that only required a relatively few number of elements. And to capture that all on one paper form, we demonstrated is impossible. So instead of being a universal transfer form, it's now a universal transfer data set. We're now in phase 3, and we've taken what we've learned from the first 2 phases and merged our data elements with the S&I Transfer of Care Framework draft data set and come up with a third set of data elements. Those are now being surveyed across the Commonwealth, and our intent is to obtain feedback from the various users and receivers across the state in multiple transitions and multiple role groups to come up with transition-specific, role group-specific data sets. And finally, phase 4 will be obtaining the approval from the S&I framework as to the choice of data elements for post-acute care. And once that happens, work that's being done by Geisinger to identify data elements that currently exist in the MDS and OASIS and pre-populated, we will be able to begin importing those already existing data elements to help the skilled nursing facilities and home care agencies begin to populate their universal transfer forms.